So, a colonoscopy and the whole process leading up to it can be unpleasant, uncomfortable, even embarrassing, but so many of us endure the procedure because we are told it works. We've been hearing for some time that colon cancer, if caught early enough, is highly treatable. Now a major new study confirms that and reveals a lot more. CBC medical specialist Dr. Karl Kabasele is here to explain. So we have been told for quite a while that at a certain age you should get a colonoscopy, but what's so compelling then about this study if we've been told this for a while?
Well, exactly as you said, it sort of intuitively, it makes sense that if you can get a camera into the colon, have a look around, you're going to catch or detect cancer cases early enough to treat them. The problem is that the evidence sort of lagged behind the idea of actually doing it. Now, we do have good evidence that having colonoscopies can reduce the incidence or the risk of actually getting colon cancer. What this new study, it took it to the next level or next step and said, well, does this actually help people to survive longer?
Right.
And the answer is yes. And in fact, they found in a comparison of two groups of people who had these polyps, these precancerous lesions, versus those who didn't, by doing the colonoscopy, they could actually reduce the rate of death by 50%. Which is, tremendous.
That is impressive. So let's talk a bit more about the procedure, because I think a lot of people hear about the procedure and that's what gives them pause to actually doing it, even though they know they should. So the actual colonoscopy process, how good and reliable is the imaging and what typically can it pick up?
Well, colonoscopy, when done well, and that's key, you need someone who has experience and good technique. But when it's done well, when the colon is well cleansed and open and easy to move the instrument through, is really the gold standard. Now, there's another device called a sigmoidoscope, so sigmoidoscopy, which goes part way through the colon. But the colon is a long, maybe 4 or 5 feet of a tube, so you really want to use a colonoscope to get through all of the corners and see all the spaces within the colon.
And what would happen if the scope actually picked up a growth or a polyps? What would be the course of action?
Well, the great thing is you can treat it immediately, and treatment is basically you cut it out, you remove it. Now, there are some cases where polyps can be more difficult to take out when they're flat. And just in terms of definition, a polyp is a growth, and generally the ones that are easiest to remove are the ones that are kind of like on a little stalk. So it's like a little ball of tissue on a stalk, stuck to the lining of the colon. You go in there, you see it, and you cut it out.
Okay. So obviously, and it's not like mammograms where you can get false positives, right? I mean, if you see it, then obviously the doctor can say, okay, let's deal with this.
Well, yeah, so you're dealing with the polyp. Now, the next step is, once you remove the polyp, you send it to pathology.
Do the biopsy.
Yeah, have a look at it under a microscope, and the pathologist can then say, well, this is a cancerous polyp or it's not. If it is, then obviously more follow-up over the coming years is going to be important.
So obviously this study reinforces the intuition that's been out there for a while, but that's important. But it's not the definitive word. I mean, there is some caution that there are some limitations to this.
Well, that's right. So this particular study was done in a very good cancer hospital in the U.S., and it was among people who were identified for colonoscopy. Now, that's different from giving everybody in the population, saying everybody at a certain age, everybody should come and have a colonoscopy. We don't know yet if there's enough evidence to support giving a colonoscopy to everybody. And there are studies in progress now that will answer that question, hopefully. But at this point, the old advice still basically applies.
And the old advice being, at a certain age, you should get a colonoscopy, and even though it may be unpleasant, consider the alternative, so go ahead and do it.
Well, it's a little more controversial, and it really depends on who you ask or which, official body you refer to. But the point is that age 50 is a critical point because we know that most colon cancers, if they're going to happen, will happen after age 50. So you should at least, at minimum, be getting stool checks for blood. We call it fecal occult blood testing at age 50 and at least every 2 years. Now, depending on your individual risk, family history, maybe past history of cancer, or symptoms. If for whatever reason, it's indicative that there might be something going on in your colon, then you may consider a wide variety of things, including colonoscopy, sigmoidoscopy, getting a barium enema with an X-ray, all of these things designed to pick up cases of cancer early.
Good to know. Thanks, Karl. Good to see you.
Thank you.
CBC medical specialist Dr. Karl Kabasele. Lots more straight ahead.